So we see males super young now that are having erectile dysfunction. A lot of times guys are embarrassed to come in and say, I have erectile dysfunction, or they don't even know what that means. And, they just know something has changed. So they'll come in under tired, or they'll come in under, I just don't feel good, or or even sometimes their wives bring them in with a decreased desire or decreased libido. So it's not as easy. And sometimes we have to, once the patient gets comfortable, like, break it down and ask them the question. We have a little check sheet, and on it asks if about erectile changes, and sometimes it's easier to check the box than actually to verbalize it. But then we really try to make them feel comfortable, and it's like, "Listen, we are all aging together. We all have the same changes." I mean, and so, um but the first step would be coming in and, again, doing a comprehensive lab panel, because things like diabetes can cause erectile dysfunction, coronary artery disease can cause erectile dysfunction. Even going back to the mental health part of it, a lot of times it's maybe not physical, but it's between the ears. If you think it's gonna happen, it's gonna happen. So we'll talk about, let's fix some of the things. We can fix your labs, we can fix your testosterone, we can control your diabetes, we can give you medication, vasodilators that help with erectile dysfunction. But then we also have to work on the mental part of it. I think it's a sensitive subject, but we try to handle it very sensitively. It's never too late. It's never too late. We had people in their 70s. I've had several patients that are, 60s, 70s, even beyond that, that come in, and they're either their spouse has died, and they're now back in the dating scene, and they want to look good, feel good, and be sexual again. And we help them. We help them with that.